Hi, Dr. Paul here. I want to talk about the typical experience people have with psychiatrists or people with mental health or doctors with focusing on mental health issues like myself. The typical approach, well, I mean, again, most people are put on an SSRI. Everyone's put on Lexapro or Zoloft, most commonly. Sometimes Prozac or one of the others, but almost everybody is put on an SSRI. Why? Because that's what psychiatrists think everyone should go on. They think everyone should, that's the first line medication for everyone. That's not true. It's actually more often not the best first line agent. If you've seen my show before, you understand that I think SNRIs are usually better. Not always. About 2/3, 3/4 of the time, in my estimation, they're better. Most doctors don't know that. And so that means most patients will never get fully better because the doctor gets them on a medication like an SSRI, which can help the anxiety, but it might cause apathy, a flattening feeling where people say I lack emotion, I don't cry when something sad happens, or sexual side effects or weight gain. And in my practice, I'm not satisfied with any significant side effects. It shouldn't happen if we do this correctly. And the other thing is a lot of doctors don't understand the importance of why you should put medications together, why you have a combination of things that they work differently, they work together. And that's kind of a lost art because a lot of doctors don't understand it and a lot of the books don't talk about it. Again, the other typical thing that people hear is, okay, I'm going to put you on this SSRI. It's going to take about 4 to 6 to 8 weeks to work. That's nonsense. No medication that I work with should take 1 to 2 months to work. They should work within a week to 2 weeks at the very most. And so this is a myth that's been pervasive in this field. And so the problem is when you tell people this, they lose hope. And if something's taking so long, it's not the right medication for the person. The other thing I hear doctors say, here, go on this and I'll see you back in a few months, or I'll see you back in 6 months. It's like, are you kidding me? That's ridiculous. I mean, if you have someone that's in your office suffering with whatever they're suffering with, depression, anxiety, whatever, you can't wait 3 months, 6 months and have people suffer in silence. And then when you try to call the doctor and they don't get back to you, this is our next appointment is a long time from now, and people lose hope, they drop out of treatment, they give up. They say, the other thing I hear, I tried treating this in the past, it never worked for me. It's like, well, maybe you didn't try the right thing. If it didn't work, how about trying something that's more correct for you? My approach has always been different from the very beginning of my practice. What I do with every new patient is I have them call me in a week. A week after treatment, I say, call me in a week, not an appointment. I'm not going to charge you for it. I want you to call me and tell me how you're doing. Within 1 week is all it takes for me to know if I put the person on the right medication. If it's the right medication, I'll know. And I might say, let's adjust the dose before I see you. Or if it's not the right medication, I change it right away. Because again, I don't want someone on the wrong medication and lose hope. So the fact that people know that they can get a hold of me easily, I do some weird things. I return every phone call every day with every patient I see. I return every email every day. And most people understand that when they call their doctor, they don't get back to me. I've never understood that in this field of medicine, especially with mental health. I mean, I'm talking about people who are suffering. They might be suicidal. And you can't just let people suffer like that. And so what I'll do is, let's say the first medication is working actually pretty well and the results are good, but I might say, well, you know what, let me add a second one to the regimen. Maybe I'll see you back in a week or two for an appointment. So what I'll do is I'm very aggressive with my treatment. And aggressive doesn't mean dangerous, and aggressive doesn't mean unsafe. Aggressive means that I go after, I try to dose it properly, quickly. I try to add things that I need to quickly and adjust things quickly. And so in my practice, my average for most patients is I get them fully better within 2 to 3 visits. Sometimes one visit's all it takes. And now if it's a more complex patient, which maybe someone with bipolar disorder or something more complex, it might take longer. It might take 4, 5, 6 appointments to get that person fully better. But the goal of every patient is full remission, fully better, and I don't stop until that happens. But I think that, being in the field I'm in, I think when people know that they can trust me, they know that they can reach me, it just gives them hope. And I think giving people hope when they feel so hopeless is a game changer for a lot of people. And so if you're not getting that kind of treatment from your doctor, see if you can and try to demand from your doctor better customer service. It's interesting in the field of medicine, with customer service is usually so bad. If you go to a hairdresser and you don't like the hairdresser, you're going to go somewhere else. If you don't like the grocery store, you're going to go somewhere else. It's amazing how people stick with a doctor that's not giving them personalized care because they don't know any better. They think, well, that's just the way doctors are. And yes, it's the way a lot of doctors are. I hate to admit it, you're right. But don't settle for that. If a doctor is not caring or not getting back to you or doesn't seem to be invested in your getting better, you change your doctor. Feel free to come see me if you have any problems. I'd love to treat you. I treat people all over the country, virtually at times, by phone. So even people who are not in my area, I can see. So. Anyway, I wanted to talk about this because it's an important subject, and I want people to understand that when you don't feel right, don't give up. Keep trying and know that there's an answer, and the answer is typically right in front of you. You just need to find the answer, and don't give up until you do.